Today I will talk about a visual symptom, that is vision problem, which lasts for a short time, but it could mean an increased risk of stroke in the future. So stroke, as you all know, is sudden onset weakness of one side of the body, and along with the face or the upper and lower limb weakness, and that's a devastating condition. It can lead to disability and even death in many cases. But one of the symptoms which is less commonly recognized is vision loss of just one eye. So what the person has is that abruptly there is loss of vision in one eye, and then it is without any kind of pain, and the vision loss lasts for say few seconds to few minutes, not more than 30 minutes, and the person completely recovers. So once the person recovers, they may have a tendency to ignore it. But what is important is that this condition where the vision abruptly is lost in one eye, and it could be a sign of stroke, impending stroke in the future, because this happens because of lack of blood flow to retina, and the artery for the retina is a branch of carotid artery which also supplies blood to the brain. So any blockage of blood flow to retina can result into this kind of condition, what is also known as Amaurosis Fugax. So if someone has sudden onset visual loss in one eye and it recovers completely on its own in few seconds or few minutes, it should be taken seriously and it needs to be investigated. The common risk factors are similar to stroke. So people with Amaurosis Fugax, they also have risk factors like smoking, diabetes, hypertension, high cholesterol, and even heart diseases. So these risk factors should be controlled, and then investigations may be required to look at the blood flow of the carotids and the brain by doing MR angiography or carotid Doppler, and then appropriate treatment should be started. So risk factors control, and then if needed, then antiplatelet agents or statins, they may be recommended by the treating physicians. And sometimes if the carotid artery blockage is severe, say more than 70%, then procedure may be required to ensure that blood flow is adequate, and that is called stenting or endarterectomy. So this can be decided by the treating doctor. So in summary, what I want to say is that if someone has sudden loss of vision in one eye which improves on own, take it seriously, get evaluated, so that a major stroke can be prevented. Because people who have this kind of visual loss, almost they have a very high risk of stroke, and every year about 2 to 3% of them can get a major stroke. So timely action and preventive treatments can reduce the risk of stroke in such people.